part of the body is it's extremely articulate. And we really focused how these two joints in a way, your glenohumeral joint, your scapulothoracic joint, I also realize there's a sternoclavicular joint involved in this too. But anyway, how they move around and give you this incredible articulation and the ability to grab stuff here and move it down here and all that kind of stuff. But now we're going to be talking about your powerful hips and thighs that allow you to propel that upper body to other locations. And it's super duper exciting. I'm super duper excited about this too, because I think that beginning massage therapists, I shouldn't even say beginning massage therapists, because I see it in general, like through the industry, where massage therapists think that back problems always have to do with the back. Which, when I say it out loud, sounds like, oh, of course back problems should have to do with the back. But a lot of back problems are back symptoms. Don't confuse symptoms for problems. Although we all do, myself included. But, you know, a lot of back problems can be alleviated if we can make the back meet the sacrum and the pelvis better, so to speak. So in this chapter, we're going to be learning about things like pelvic tilt and all the things that kind of help your spine have a good solid foundation to sit on. And then this incredible pelvis that's holding up this big spine, it has to go wiggling down the road while it's holding this big spine up it and run it down the road. So anyway, that's chapter 6. I'm very excited, very, very excited. Today we'll just be looking at some bones because that's where you got to start, right? And we will be talking about little bumps on the bones, protuberances and tubercles and trochanters, and all that just is fancy talk for bumps. And we'll be looking at fossas, which are those, you know, divots, holes in the bones too. And we look at all this stuff because we know that all those places are places where muscles will attach, or joints work on, or whatever. So we're going to be studying all that today. So not all the muscles today, obviously, but my point is learning the bones really well helps with the muscles that come, which I will sound like a broken record by the end of this course because I'm going to say that over and over again. Cool. All right. So let's take a look at our slide presentation. But before we do, I want to make one really interesting point. I want to help transition you. So we've been kind of dealing with the upper body, right? We have a rib cage up here and all sorts, and arms coming off here. And we're now going down to the lower body. We're now going to go from the axial skeletal system to the appendicular skeletal system. We first did the appendicular skeletal system of your arms, then we did the axial skeletal system of your ribs and your vertebrae, and we're now going to go back to the appendicular skeletal system of your legs. So this is somebody's backside, this is their sacrum, and right here where the sacrum meets the hips, right here where the sacrum meets the hips, which can be found, by the way, right here at the posterior superior iliac spine, PSIS, is the sacroiliac joint. This is the joint between your sacrum and your ilium. Your sacroiliac joint is responsible for distributing all of the weight of your upper body to your hips. Your sacroiliac joint is the connection between your axial skeletal system and your lower appendicular skeletal system. I'm telling you that because it's extremely important to know as a structural massage therapist because people get a lot of tension at their SI joint, their sacroiliac joint. I'm also telling you because it's probably the most common massage question on massage tests. Not the only one, but it's one of those things where people go, well, at what joint does the axial skeletal system meet the appendicular skeletal system of the lower body? And it's like the SI joint. So if you've ever had an aching, like deep down, like kind of in your sacrum, Miss Estes, you have an aching down in your sacrum, that's often in the sacroiliac joint. That doesn't mean that's necessarily the problem, but it's definitely felt in that area because it's under a lot of tension. Yes, somebody, yes, Miss McDowell.
If someone has like their L5 fused to their sacrum, what does that actually mean?
So this is from the front because sometimes it's a little easier to see. Here's the sacrum here. That's L5 right here. And that's a disc. That's an intervertebral disc. You've got one between every vertebra. When they fuse them, they tend to weld these two bones together. Now, they weld them in different ways. They'll put a screw in there sometimes, and if you screw them together so they can't move, they'll eventually calcify.
No, not like with surgery, but like you're born with like a fused disc.
Oh, cool. All right. What it means is you don't articulate at that point. And it probably, in and of itself, doesn't matter too much, assuming that they're fused relatively level. So, but it just means that this person cannot bend then at L5S1, right? But remember, we don't bend much at every vertebrae anyway. It's all the vertebrae together that give us the flex we experience, but each vertebrae doesn't really flex very much at all. So one fused vertebrae would, in and of itself, would mean nothing. Could it cause somebody lots of problems? Oh my gosh, yes. Let's suppose they're not fused and they're not quite level and it kind of throws off the rest of the back and they're kind of stuck with that. I mean, that kind of stuff. But in and of itself, it doesn't mean anything. It just means they've lost mobility at that area. It just formed kind of funny. Some people, by the way, even though there's 5 lumbar vertebrae, some people have 6. It's rare. And the last vertebrae is kind of thin, actually. And sometimes they have some problems too, because the last one doesn't seem fully formed right, maybe. But it doesn't instantly mean trouble, because they sometimes do it even in surgery and stuff. Do you know somebody who's got that and it causes them problems?
My fiance said that when he went and got a massage before, like they felt his back and they're like, oh, this is fused. Or he went to a chiropractor and they're like, oh, this is fused. And then on X-ray, it like showed like it was fused with his sacrum. I don't think he has any problems with his back.
No, I don't. If he's not, don't put it into his head either. I don't think it's anything to worry about. And I was going to say, I don't think the massage therapist could tell. It had to be a chiropractor and they had to take an X-ray. Because I don't think I could tell that somebody was fused just by touching them down there. There's too much fascia over the area. You know, you got the thoracolumbar aponeuroses, you've got the spinal erectors coming down there, you got the QL. I mean, it's just it's a mess down there in a good way. Now, when you start fusing too many things in the back, then obviously you lose flexibility, but he probably doesn't even have a noticeable loss of flexibility. Because it's so far down, by the way, too, we don't bend a lot at those that last lumbar vertebrae anyway. Yeah, that's my thought.
Okay.
Cool. Very interesting. Okay. So let's present Miss Trotter. Is that your puppy? Yeah, it's your puppy. You love your puppy, don't you? You're very happy right now, aren't you? Yeah. So cute. Is this the puppy that's named after, is it some Star Trek thing? Some kind of...
No, her name's Tinkerbell.
Oh, Tinkerbell! Tinkerbell. That seems very appropriate. Hi, Tinkerbell! Tinker? Who's a good girl? All right, everybody, I hope you can see the screen right now. You can see... a picture, a sketch of my actual thighs when I'm hiking. This is what they look like. And by the way, we can see the beautiful iliotibial band coming down this leg, right? You see the white piece of fascia coming down there, coming all the way essentially from the hips. That's not exactly accurate, but that's okay. And the glutes, that is accurate, and it goes down across the knee on the lateral side. That's the iliotibial band, which is a band of fascia that we'll be exploring in this section as well. This is going to be a neat section because we're going to put together, the glutes, the deep 6, the 4 quads, the 5 adductors, and the 3 hamstrings. We will be covering all of those. Yeah? Do you guys remember all those? Everybody? Yeah? Feeling pretty confident about that? Miss Estes seems pretty confident. Miss Estes, he said with a cocky tone in his voice. Miss Estes. Miss Estes, what are the 3 gluteal muscles?
Those are the gluteus maximus, medius, and minimus.
And what are the deep six lateral hip rotators that are found under the gluteus maximus?
Okay, well, we have the twin sisters, the gemellus, superior, inferior. We have the obturator, externus and internus, and we have the piriformis and the quadratus lumborum. No, quadratus femoris.
Wow. That was, even your correction was good because because the logic that you used, I really like that. Okay, you have redeemed yourself. I'm going to ask some other people. That was really good. Okay, Miss Vincent. Sorry, I just saw you there, so I want to pick on you, Miss Vincent. What are the three hamstrings that are found in your posterior femoral compartment? Three hamstrings.
Your biceps femoris, semimembranosus, and semitendinosus.
That was really good. I'm really impressed because I think it's actually very hard to be asked a question kind of out of left field. You know what I mean? Okay, well, don't go anywhere because you're doing so good. Yeah, don't touch that dial. Sorry, reminded me of a Chicago, never mind. There's a Chicago radio station who used to always say that. Anyway, what are the four quad muscles that are found on the anterior and lateral compartments of the femur?
Oh my gosh, I haven't looked at these in so long.
It's okay. I don't blame you. I can give you hints if you want. We can also, if you just want me to call on somebody else, just pick on somebody else, I'm happy to. You already nailed yours.
Yeah, I'll do that.
Okay.
I'll relearn it through listening to someone else.
Yeah. Mr. Placencia, you look way too comfortable. What are the the four quads, sir?
We got the. Geez. Hold on. It was. I know there was some that were named by their size and their.
Yeah, they're all very vast. Not all of them, but most of them are very vast.
Yeah, vastus medialis, vastus lateralis, vastus intermedius, and last one starts with a G. No.
That's inner thigh.
Okay. I don't remember those two. Hold on, I'm gonna reference to my notes.
It's a muscle that runs up and down your femur.
Hold on, what's the notes? Sorry, the break we took really made me forget everything.
Nope,
Like,
sir,
no.
don't. Guy, nobody here needs to apologize. You guys are doing really good, and I sincerely mean that. Like, I'm not worried. And we were reviewing these every day, and then I let it go for like 2 weeks. So I know what happens. What?
Rectus femoris.
Rectus femoris, the muscle that runs up and down the femur. Awesome. Thank you, sir. Yeah. Miss Lobitz, what are the, I love you. What are the five medial compartment hip adductor muscles?
Adductor longus, brevis, magnus, gracilis, and pectinis.
At least act like you're trying next time. At least, like, hesitate for a second, something. Which one of those is actually the longest?
Oh, is it the gracilis?
Yeah, the gracilis is actually the longest and in a way the most medial. It's like dead center down your leg. The gracilis, yeah, good. Good job. Again. Okay, so we got, I think we covered, did we cover then all the glutes, the deep six, the 3, 4, and 5? Did we get all the whole thigh and everything? Does that sound right, Miss McDowell? Were you paying attention? Did you get everything? Good. Okay, so Miss McDowell, help us review all that really quick just so everybody can hear. I don't want you to forget stuff before you get married. So what are what are the three gluteal muscles?
Gluteus maximus, medius, minimus.
Which one is most posterior?
What was the question?
Most posterior. They are different.
Most posterior is the maximus.
Thank you. Which one's most anterior?
Most anterior would be the medius. No, the minimus.
Yeah.
Minimus.
It goes max, min. Yeah, cool. All right. What about the deep six?
The piriformis, gemellus superior, gemellus inferior, the obturator internus, obturator externus, quadratus. No. femoris, quadratus femoris. Yeah, they broke their leg. Quadratus femoris.
Broke their leg. I've never heard Mr. Ibarra's story. I only get to hear like the product of the story, so it always cracks me up. Like sisters in the cave.
And next time we'll tell you.
It's kind of more fun not knowing. Which one? Now, this isn't fair because I don't know that I've taught you this yet. But why be fair now? So, which one of those muscles, those 6, are the most superior?
Piriformis.
That's right. Okay. Wow. Okay. Which one is most inferior?
It's either the obturators or the quadratus femoris. Yeah. Okay. Yeah.
Yeah, it's piriformis and then quadratus femoris right here, and the other ones stick right in there. Cool. Good job. Okay. What are the 3 hamstring muscles from medial to lateral?
Semitendinosus. No. Membranosus, semitendinosus, bicep femoris.
Wow. What are the 4 quadriceps femoris muscles?
Rectus femoris, vastus, lateralis, vastus, vastus intermedius, vastus, lateralis.
I think medialis. I think you said lateralis twice, but I could be wrong.
Oh, excuse me.
You're fine. You're fine. What are the 5 hip adductors?
That would be the adductor magnus, adductor longus, adductor brevis, pectineus, and gracilis, and also in the quads it's the sartorius.
Oh, that's true.
Well.
You're right.
Sartorius.
Sartorius, by the way, everybody, is not in a group. It's on its own. It's a lone wolf. But it would be in that anterior leg compartment kind of thing. Yeah, cool. Sartorius, thank you, because we will be learning about the Sartorius. Really nice summation. All right, I want to call my other class here really quick just to make sure that they're getting ready to graduate. So we hope they can do this. And now I put all this pressure on them. Miss Bolotic, are you there?
Yeah, sorry, I'm driving.
No, you don't have to be sorry. You're not doing anything wrong. Miss Bolotic, can you tell me the 3 gluteal muscles?
The gluteus maximus, gluteus medius, and gluteus minimus.
Cool, good. We're off to a good start. Can you tell me the 3 hamstrings?
The vastus intermedius.
Stop. That's quads. I want to know those too. But these are in back.
Wait, what? Sorry.
They're in back. They're posterior muscles. It's 3 hamstrings. You give me the 4 quads.
Oh, sorry, I didn't hear that.
Don't worry about it.
But
if you want to do the 4 quads first, you can.
No.
Sorry.
No, I feel bad because I haven't reviewed them in a while.
Don't feel bad. Hold that thought and listen up because I'm going to call on you again in a second, okay?
Okay.
Don't feel bad though. That doesn't help. Miss Cooper. Miss Cooper, if she's still here, let me check really fast.
What's going on?
Oh, good. Miss Cooper, jeez. Miss Cooper, you're scared.
What's happening?
Miss Cooper, I need to know some muscles. Do you know some muscles?
I think I know. Some
Okay,
muscles.
let's do it. Miss Cooper, she's like really on fire today. Miss Cooper, what are the 3 gluteal muscles?
The gluteus maximus, gluteus medius, and gluteus minimus.
Good. What are the deep 6 lateral hip rotators that are found underneath the gluteus maximus?
Gemellus superior, gemellus inferior, obturator internus, obturator externus, piriformis, and I always forget the last one. Does it start with quad?
Yep.
Okay. Quadratus femoris.
Yes. What are the 3 posterior hamstring muscles?
Give me 1 second.
Take your time.
Give me a second. Hold on. Are they vastuses?
No, those are the quads.
Oh, that's the quad. My bad.
Yep, they're very popular today. You can give me the 4 quads if you want. I'm going to ask that next.
No. What did you even ask me? Lord, you got me burned.
job, actually. You'd be upset later if you paid all this money and I didn't push you.
Yeah.
What are the 3 hamstring muscles that are found on the posterior side of your femur? They actually have 4 heads, but they're 3 muscles. Because one is a 2-headed muscle on the femur. That's a lot of hits. And the other are semis.
Bicep femoris?
Yes! And semi what?
Semi-membranosus and semi-tendinosus.
Good.
I hate these. You always ask me this question, and it's always so. It's good that you ask me this so I can remember, but it's also so embarrassing because I know
It
the
is.
other ones.
It is. Hey, by the way, actually, there's a reason I teach this way. Honestly, it's because when you guys get asked a question, guess what's going to be asked by a client right in front of you. And so I'm trying to kind of get you used to that so that you're just like, oh yeah, of course. Like you can kind of keep your cool because otherwise you panic and they can see the fear in your eyes and it's all over. So that was good. So what are your 4 quads now? You started trying to give me those earlier. Those are the vastuses. What are they?
Vastus lateralis, vastus medialis, vastus intermedius, and something.
Yeah, something is right. It's a muscle that runs.
Rectus femoris?
Yes! Whew! Last one here. What are the 5 adductor muscles that are found in the medial compartment of your femur?
Adductor magnus.
Yes.
Adductor longus.
Yes.
It's ab, right?
Add.
Ab.
Sorry.
Oh my God.
Because you want them to pull your legs up together and they're in the middle. They have to be in the middle. They have, yeah. So wait, adductor longus, magnus, and what?
Brevis?
Brevis, yes. And what are the other 2 that don't have adductor in them?
Yeah, I don't like these.
Yeah. I don't care. One starts with a P and one starts with a G.
Gracilis and piriformis?
How about gracilis and pectineus?
Oh, yeah, maybe.
All right, thank you, Miss Cooper. Miss Young. Hi.
Hi.
Hi. We're gonna say some muscles together, okay? Just say what I say.
Yeah.
3 gluteal muscles. Gluteus
Gluteus
maximus.
maximus.
That was good. Gluteus
Gluteus
medius.
medius.
Good. Gluteus
Gluteus
minimus.
medimus.
Minimus. That was good. Sound like Minnie Mouse. I kind of like that. Okay. 3 hamstrings. Biceps
Biceps
femoris.
femoris.
Beautiful. Semi
Semi
tendinosis.
tendinosis.
That was really good. Semi
Semi
membranosis.
membranosis.
Great. Okay. 4 quad muscles. Vastus
Vastus
lateralis.
lateralis.
Good. Vastus. Vastus medialis.
medialis.
Yes. Vastus
Vastus
intermedius.
intermedius.
Good. Rectus
Rectus
femoris.
femoris.
Good. Last ones. 5 adductor muscles. Adductor
Adductor
magnus.
magnus.
Adductor
Adductor
longus.
longus.
Adductor
Adductor
brevis.
brevis.
Pectineus
Continuous.
gracilis.
Gracilis.
That one's hard, but that was good. Gracilis. That was good. That's good. All right. Cool. All right. Thank you. Miss Sarno. Let's try it. Yeah. All right, Miss Sarno. If you get okay. Yeah, I know you are. She's like this. All right, Miss Sarno. What are the 3 gluteal muscles?
Gluteal muscles. Okay,
You said it right, my dear. Gluteus maximus.
Gluteus maximus.
Good. Do you know the next two, or do you want me to say them with you?
Can you say it in English?
Of course I can. Of course I can. All right. Let's do the first one again. Gluteus
Gluteus
maximus.
maximus.
Good. Gluteus
Gluteus
medius.
medius.
Gluteus
Gluteus
minimus.
minimus.
Yeah. By the way, Miss Young, thank you. She is saying it with us. I love that. Thank you. That is exactly right. Yeah. The rest of you, I don't know what you're doing. But Miss Young, she's got it. Okay. All right, Miss Sarno. That was the 3 gluteal muscles. There are 3 hamstrings in the back of your leg.
Okay.
Biceps
Bicep
femoris.
femoris.
Semi
Semi
tendinosus.
tendinosus.
Semi
Semi
membranosus.
membranosus.
I'm not laughing at you, by the way, Miss Sarno. I keep looking over at Miss Trotter occasionally, and she's cracking me up today. Like she's on her side. There's a dog on her neck. It's funny. Okay. Let's do the 4 quadriceps femoris muscles that are in the front and the side of your leg. Vastus
Vastus
lateralis.
lateralis.
That was good, actually. That's really hard to say. Vastus
Vastus
medialis.
medialis.
Yes. Vastus
Vastus
intermedius.
intermedius.
And rectus
Rectus
femoris.
femoris.
Okay. And now there's 5 inner thigh muscles. They're between your legs in the medial compartment of your femur. And that is adductor
Adductor
magnus.
magnus.
Adductor
Adductor
longus.
longus.
Adductor
Adductor
brevis.
brevis.
Gracilis.
Gracilis
That was perfect, actually. That's a hard word to say. Pectineus.
pectineus.
That was good. All right. Good stuff. Miss Carodi?
Yes.
Hi, Miss Carodi. Miss Carodi, I feel like, with the greatest respect to everybody, I don't mean in a ranking sense, but I feel like you're very good at these, and you can probably say them. So, can you tell me the 3 gluteal muscles? If you get stuck on anything, I'll jump in. But can you tell me the 3 gluteal muscles?
Yeah, gluteal maximus in gluteal as minimus. Gluteal as medius.
Yeah. Gluteus maximus, gluteus medius, gluteus minimus. Beautiful. Can you tell me the 3 hamstring muscles?
And the back femur ribs. Semimembranosus.
Yeah.
Semimembranosus.
Those are great. Biceps femoris, semimembranosus, semitendinosus. Beautiful. Can you tell me the 4 quadriceps femoris muscles that are found in the anterior and lateral compartment of the femur?
Vastus lateralis.
Yeah, vastus lateralis. Sorry.
Medialis.
Yes, vastus medialis.
Vastus intermedius.
Vastus intermedius. Beautiful. And
Rectus femoris.
that was perfect, actually. Rectus femoris. Yeah, I love it. Okay, 5 hip adductors that are found between your legs.
The adductor magnus.
Yes, adductor magnus,
Adductor longus.
adductor longus,
Adductor brevis.
adductor brevis.
Gracilis.
What was that one?
Gracilis.
Gracilis. That was perfect. Gracilis. I just didn't catch it. Good.
Pectineus. Yes.
Pectineus. Thank you, ma'am.
Yes.
That was beautiful. Thank you. It's very impressive. Okay, Miss Bilotic, I'm going to come back to you. I haven't forgotten about you. You there?
Yeah, I'm here.
Okay.
I'm so bad at driving and doing like something else. Like I have to completely focus on driving.
I hear you.
I'm
So
sorry.
it's okay. You might want to pull the car over then.
Well, now I'm in a neighborhood. It was so busy out.
It's totally cool. I can't even imagine, actually. It takes my entire focus to do this class. I mean, literally, a little thing distracts me, it's all over. Okay, what are the 3 gluteal muscles?
Okay, gluteus maximus, gluteus medius, and gluteus minimus.
Thank you, ma'am. What are the deep 6 lateral hip rotators underneath the gluteus maximus?
Obturator internus and externus.
Yep, obturator internus externus.
And then that's where I blanked out on these. Gemellus. Is that what you're saying? Okay. Gemellus. Something with a P.
How about-
Piriformis.
Well, hold on. We got 2 gemelluses. We got one up and one down. So gemellus.
Oh, yeah. Gemellus inferior. And then gemellus superior.
Yes.
No, inferior and superior, yeah.
Yeah. And then piriformis.
Yeah, piriformis.
And then one last one that's a 4-sided muscle on your femur. Quad. Yeah, you already said that one. You need a 4-sided muscle on your femur now, like something like a
Quadratus, no. Yeah? Quadratus femoris.
Yeah. All right, good. All right, we're almost done, but not really. What are the 3 hamstring muscles? The 3 hamstring muscles found in your posterior thigh.
So, the semitendinosus, the semimembranosus,
Yeah.
and the bicep femoris.
Yes, thank you, thank you, thank you. And what are the 4 quads that are found in your anterior and lateral compartment of your leg?
The rectus femoris, the vastus intermedius, the vastus lateralis, and the vastus intermedius.
We already did
Did I
intermedius.
say that one?
What's the opposite of lateralis? Medialis, good. And last, what are the 5 hip adductor muscles found in the medial compartment of your femur?
So these are all the adductors, right?
Yes.
Okay, so adductor brevis, longus, gracilis, and then magnus.
Yes, adductor magnus, gracilis, and then there's a P one.
Pectineus.
Pectineus. Thank you, ma'am. Keep driving safe. All right, everybody. Thank you for your patience, everybody. I just, kind of got off on a tangent there, but I kind of want to nail some of this stuff down. All right. So we can all see what we're sharing here. I already made a joke that it was my thighs and stuff. I want to point out something on the naked person I'm showing you here. What I want to point out is actually the anterior superior iliac spine and the greater trochanter. To me, these are some of the most important landmarks. The greater trochanter is the side of your femur. It is a bump on your femur, and you can feel it from people's thighs. The anterior superior iliac spine is a bump on your hips. It's actually, Ms. McDowell, we were talking about the iliac crest today. The iliac crest actually starts or ends at the anterior superior iliac spine and ends at the posterior superior iliac spine. Like that's the bumps at the end of this crest. So that's it. Cool. All right. Oh, and one other thing. Obviously, I put a box around it here because I think it's super important. The posterior superior iliac spine. Why would I care about that silly little bump right there called the posterior superior iliac spine? What do I use it to find? Anybody?
The sacrum or the iliac crest?
God, you're so close. You're so close. It's true, the sacrum's right there. Like, you're right there. If you almost put those answers together, it would be really right. I use it to find the SI joint. If you can find this bump, the SI joint is right there. And so, when I am on somebody's sacrum, by the way, since you were talking about finding this, I slide out until I hit this bump. And then if I hook the bump, if I stay on the inside of it, the medial side of it, if I hook the bump and go in right there, that's the sacroiliac joint. This is the posterior superior, I know you can't see it well, but this is the posterior superior iliac spine. You follow the hip, you can hit that. You come from the sacrum, you can hit that. And if you go inside it, that is the sacroiliac joint. And it's kind of neat to be able to find it when you're an advanced therapist and you want to wiggle in there. So that's very cool. Thank you. Thank you, thank you. Okay. Let's look at the bones of the pelvis and thigh. Okay. So lots of stuff to talk about here. Let's talk about your hips first though. I'm actually talking about the view, the picture you guys see in the bottom right of this slide, where it shows you the ilium, the ischium, and the pubis without a femur in it. There's no femur in this bottom right picture, okay? In fact, that hole where those 3 red lines are coming together, that is your acetabulum. And your acetabulum is literally where your acetabulum is literally where your femur hooks into. It is this hole here, it is a big hole, and the head of the femur literally goes in there. It's a true ball and socket joint. So that's what you're looking at there. That's cool. The ilium, ischium, and pubis are called the ilium, ischium, and pubis because they started out as 3 separate bones in all of you. They came together and at where the acetabulum is, and they fused. They did that. I know somebody's going to ask me when. Yes, Miss McDowell? This I think I know because it shocked me. I thought it would all happen inside the womb kind of thing. You know what I mean? Like, but no, it's forming even while you're a teenager. They're held together by cartilaginous joints, but eventually they completely fuse, and that happens during your teenage years. So they're not even fully fused until you're older. And I don't know exactly what age, but some of the stuff I've read suggests that they may not even be fully fused till you're 18. Like, it's really a long time. They are sewn together very tightly by cartilage, but they actually completely fuse into one indistinguishable bone later on in life. So we call them these 3 different bones because they were 3 different bones, but we also call them these 3 different bones because probably your hip bones, the ilium, the ischium, and the pubis, are probably going to be the most complicated bones we study in this entire class. They've got weird bumps and grooves and insides and outsides, and they go everywhere, and they're 3-dimensional, and they end up coming together with your sacrum and each other and making a soup bowl to hold your intestines, and they're very complicated. And so massage therapists rarely, and physical therapists and doctors, rarely just talk about your hips, unless we're trying to explain some simple concept. We will usually talk about the ilium or the ischium or the pubis and then something on it. So just be prepared for that kind of talk because we recognize the 3 bones are sewed together, but we're trying to get you in the general right area, right? So your hips are made out of 3 bones, ilium, ischium, and pubis. Yeah? Cool. Miss Trotter, what 3 bones make up your hips?
The ilium, ischium, and pubis.
Yes. Thank you, ma'am. Mr. Tate, what 3 bones make up your hips?
The ilium, the ischium, and the pubis.
Thank you, sir. Miss Allure, what 3 bones make up your hips?
The ilium, the pubis, and the ischium.
Woo, way to switch it up. I like it. Okay. Thank you, ma'am. Mr. Blygen, since I can see you, what 3 bones make up your hips, sir?
My hips?
Yeah, your hips.
Okay, the ilium, ischium, and the pubis.
Thank you, sir. I appreciate that. Okay. And Miss Walker, why? What 3 bones make up your hips?
Ilium, ischium, and pubis.
You guys are the best. Thank you very much. Okay. So obviously the ilium, everybody, is the most superior one. And then the ischium and the pubis are kind of inferior, and one's anterior, one's posterior. Your pubis is anterior. Think pubic, right? Yeah, you can feel your pubic bone, by the way, where they come together. You can feel all these bones. Your ischium is what you're sitting on right now. And you might be able to feel it if you're on a hard chair, even, because you can sometimes feel that bone. And some people call the ischium the sits bone because they sit on it. And this is terribly confusing because remember how we remember the rotator cuff muscles? Rotator cuff muscles are actually remembered by using sits, superior, inferior, supraspinatus, infraspinatus, teres minor, and subscapularis. Thank you. I felt like Miss McDowell was going to help me there for a second. Anyway, so what I don't like, I know I've already said all this, but what I don't like is a lot of people now call these rotator cuff muscles the sits muscles. It drives me nuts. Anyway, that's just a way to remember them. And then that makes it confusing with the sits bone, which has nothing to do with it. And the sits bone makes sense to me because you're sitting on it. It's your sits bone. All right. Anyway. Do you guys see below the acetabulum, there's a hole? The acetabulum is a divot, right? But there's actually a hole that you can look through in this bottom right-hand picture. Do we see that? Do we remember what word we use for hole?
Foramen.
Foramen, thank you, sir. That is that's the obturator foramen. And you know how we have an obturator internus and obturator externus lateral hip rotators? They hook to that hole. That's how they got their name. Do you guys see the ischium there, right where that arrow points to on the ischium? Is where almost all your hamstrings attach. Yeah, and that bottom handle of the hole is where all your adductors attach. Yeah. Just stuff to know. Okay, all right, let's go back up to the main picture. The main picture shows the lumbar vertebrae, that's L5, meeting the sacrum. It shows the sacroiliac joint from the inside. You will never see it from the inside, right? We will only feel it from the outside, but it shows it to you there. The coccyx, which is your tailbone, right? Probably a third of you have already broken it at some point in your life. It's really easy to do. And they don't have it labeled here, so we won't worry about it yet. And the femur, of course. Yeah. Cool? Just big overview stuff. Yes, Mr. Blygen.
Where is the tailbone located in relation to your butt?
No, it's a really good question. So if you, and I'm not trying to be weird here, even though it's a little bit funny, but if you put your finger back and find your butt crack and start going down it, you'll get to the end of your sacrum and you'll feel like a little tailbone. On most people, it tucks in just a little bit. It's meant to protect you, right? But a lot of people break theirs, and it'll even be off to one side or the other, and you can actually feel it. You don't feel it on a lot of clients because it's too far down, but you could. You could do it in very specific situations if you had to. It can be done, and it can be done with dignity. But in general, we stop before we get to the coccyx. But it's this little thing at the end of the sacrum, and you can kind of feel it down there. And sir, when your finger is down there, to know if you feel it, you hop off to one side or the other, and if they hop off right away and it's about the size of a pinky, and you can kind of feel yourself on each side of it, that's your coccyx. Did you try all that? Did you put your finger back there?
Yeah, I'm gonna wash my hands now.
Okay, good idea. Yeah, I don't want it to be another traumatic experience, like the one you described today.
What did I say?
That was something about Dubai, and yeah, never mind.
Oh, yeah, we're not gonna go there.
We're not going to go there. I'm teasing you. Yes, Miss Sarno.
Yeah, can I have a question?
You can have question.
And I see some customer, they have like a sacrum and the coccyx and the butt crack and the coccyx, they go not in the line and they go on the side.
Yeah.
And have something to do with the spine or not, because sometimes I'm not sure what it happened, but sometimes they born with, sometimes they just
They might be born with that. It's very normal. They could be born that way, but more likely they broke it. So when you guys have all watched little kids walk around, right, and they fall down on their butt, right?
Yes.
We see that all the time. Well, when they're kids, they're kind of rubbery, and usually they don't break it. But it doesn't take much to fall on your butt and break your coccyx. And it's got so much fascia woven in there, they can't put it in a cast or anything, and so it just kind of heals just a little bit crooked.
Yes.
I bet they broke it.
Yeah.
They broke it. They broke it, and it healed that way, and it's probably okay. It probably doesn't matter.
Okay.
I mean, some people, yeah. Because what? More question? More?
I don't know. Sometimes the adult, the people maybe 20 or something, they working hard and they just on the computer they sit one side and after that they.
Yeah, it could cause some problems. I know that I know a rolfer, and if he finds your coccyx out of place, he thinks it's important to your structure, and he wants to make it. He wants to get it back like this. He wants to fix it, and he's done this before. He actually puts on gloves, and he will take his fingers. I don't know if this is legal, by the way, but he's doing it for legitimate reasons. But he puts his finger, one in your anus and one on top of your sacrum, and works the coccyx till he can straighten it out and move it over. Because it is fascia holding it there. I don't think you should do that, though. No, don't do that. Good.
No, I don't think to do that because I just have question. If that happens, that they have something wrong with what they sleeping or they just sit sometimes they play game and just sit one side and after that they don't move. Or
I do agree with that. Yeah. So if I'm hearing you correctly, and I agree with you, if the coccyx is off to one side and it's kind of bugging them a little bit, sometimes they'll sit weird, and then that can cause other problems. Yes, that's true. Yeah.
Thank you.
Thank you. Okay. Woo! Mr. Blygen, you still have your hand up. Nope, took it away. Okay. All right, fine. Be that way. Okay. Here we go. Moving right along. How are we doing? Do we need our break, by the way? Oh, okay. Miss Vincent, you seem pretty adamant about this, and okay. We're just getting ourselves familiar with these funky bones. Anyway, all right. So we've looked at the hips. The hips are made up of 3 bones, right? Ilium, ischium, pubis, and the femur. The femur is the longest, largest, strongest bone in your body. You rarely see them broken. It does happen in car accidents sometimes, but it's rare. They're really powerful. Okay, moving right along. Oh, forgot to tell you one thing. The name for hips. Yes, massage therapists normally talk about hips as the ilium, ischium, and pubis. So do physical therapists, so do trainers, and all sorts of people. But anyway, but if you had to talk about the hips themselves, a lot of people call them the coxals. It's up there on the slide, C-O-X-A-L. I don't use that term very much, although I have. It's not unheard of. Like, people do use it. But the coxal bones, they mean the hips as a totality. But we usually are talking about a place on the hips, so we usually say ilium, ischium, or pubis. But it is, something to know. And so some people call that the coxal joint, where the hips meet the femur, instead of the acetabular femoral joint. I like calling it the acetabular femoral joint because it's ridiculously long, but it makes more sense in my brain. Yeah. Okay. Moving right along. Okay, good. Okay. So this is actually a pretty good picture. Here we can see the iliac crest. Please familiarize yourself with the iliac crest. You should be able to find it on every single human being. This is not hard. This is your hips. When people are like, oh, these pants come up way high above my hips, or these are low hip pants or whatever, you're talking about the crest of your ilium, the iliac crest, the top of it. Those are your hips. That's what we think of as hips as lay people, right? But that is your iliac crest. If you follow your iliac crest anteriorly, if you move forward on it, you will run into what? If I follow my iliac crest anteriorly, what do I run into? What's the first thing I run into? I mean, first landmark, labeled landmark.
ASIS.
ASIS. Miss Estes, thank you. Hey, Miss Estes, what does ASIS stand for?
Anterior superior iliac spine.
Yeah. And by the way, everybody, you will learn this about anatomy. It is true 100% of the time as far as I know. If somebody says anterior something, there's a posterior. If somebody says superior something, there's an inferior. Just like if you know my name is Tapscott Jr., you know there's a senior. Otherwise, I'd just be Tapscott, right? Which I am, by the way. There is no senior, thank God. Yeah, sorry. I don't like it when people do that. So if there's an anterior superior iliac spine, you know there's posterior ones and you know there's inferior ones, right? All right, so if we keep going forward, although we're gonna have to start going down now, after the anterior superior iliac spine, what do we get to next?
The AIIS,
Yes.
anterior inferior iliac spine.
Yeah, the AIIS, yeah. You will probably not feel that on people. Here's why. The anterior superior iliac spine, the bump that we first came to, is where the sartorius connects. The anterior inferior iliac spine is where the rectus femoris connects. And there's enough meat on top that it's very hard to feel the bump of the anterior inferior iliac spine, but it doesn't matter. Because all we need to do is find the anterior superior iliac spine. That's super important. All right, if we keep kind of curving down, now we're kind of curving down this thing, and we're into the pubic bones now. We've kind of transitioned from the iliac crest down the anterior superior iliac spine, down the anterior inferior iliac spine, and we've all of a sudden just gotten onto the pubic bones. We've actually gotten onto what they call the superior ramus of the pubis, which means the arm, the superior arm of the pubis. We'll get into that more later. And we're going to meet where one pubic bone comes into the next pubic bone. And when they meet, it's a symphony. And that symphony is your pubic symphysis. It's where the two things come together like a symphony. Pubic symphysis, that is a cartilaginous joint there. It actually has a little bit of flex. Not like what I'm doing. It does not do this. But the point is it can, flex a little bit. And that's your connection. That's your pubic crest there, but also your pubic symphysis. I know they didn't label it there, but that's your pubic symphysis where your two pubic bones come together. And your pubic tubercles there are attachment sites for other muscles. We will get to that. But those bumps are there for a reason. That's it from that picture. By the way, the inside of your hips where it says iliac fossa, later we're going to learn about a muscle called the iliacus that actually attaches in the iliac fossa. So it's not just there for no reason. Okay. This is a posterior view. We are looking at this person's bottom, right? It's a posterior view right now. And there's a lot of stuff labeled, but don't become overwhelmed because a lot of it is you already know, and a lot of it will make sense once I kind of explain it. You'll be like, oh yeah, I don't have to memorize that. But we can still see the crest of the ilium, right? But as we follow it backwards, posteriorly, the first thing we come to is what? What is the crest of the iliac crest turn into as you head posteriorly? Going once, twice, anybody? It's on the right hand side, 3 down. Thank you, Miss Estes.
PSIS?
Yes. Miss Estes.
Huh?
What does PSIS stand for?
Posterior. What is it? Posterior, superior, iliac spine.
Thank you. By the way, they use spine. We think of spine as your spine, but spine just means like a tubercle or a protuberance. It's something poking out. And there, yeah. So that's the posterior superior iliac spine. It's in back, but still on top because there's a little tiny one underneath it called the posterior inferior. You'll probably never feel the posterior inferior. Again, it's very hard to find. Very hard to feel. But the posterior superior iliac spine is super important to me because why? What do I use it to find?
The SI joint?
Yes. And what does SI stand for?
Sacroiliac joint.
What is it with you people and your abbreviations? I'm teasing. Yeah, sacroiliac joint. By the way, everybody talks the way you two were just talking, like SI joint and ASIS, all that stuff. But we're learning the terms right now. But when you leave here, you're right. That's all they'll say. Yeah, it's how I find the sacroiliac joint, which is, what's the significance of the sacroiliac joint, Miss McDowell? I'm sorry, I don't know. It's cute.
think it has something to do with movement, but I don't know what the significance is.
It's where your axial skeletal system meets your lower appendicular skeletal system. So it's where the weight transfer from your entire upper body has to take place to your lower body.
Okay.
Yeah. Thank you, ma'am. Okay. So then they've got some stuff labeled here that we will not use a lot, and I almost don't want you to memorize. We all know what the sacrum is, right? The sacrum is this weird upside down triangular thing in the middle of this picture with a whole bunch of holes in it. Almost looks as though it was vertebrae at one time that fused together. And it looks that way because guess what? It was that way. It's made up of about 4 separate parts that fuse together, and those holes actually have nerves coming out of them later, so they're super important, and that's why I want you to massage the sacrum, right? In fact, we know a muscle that covers that whole sacrum. What is that muscle that kind of covers the sacrum? It's really on the spine, but then it comes down and goes over the sacrum, which makes it different than a similar muscle that goes down the spine, but doesn't cover the sacrum. And I think this movement is really important in the answer. Because I didn't say comes down the spine, I said comes down the spine. Yes, Mr. Placencia, please.
Multifidi?
It is the multifidi. Thank you, sir. The shoelaces of the back, the multifidi, cover the sacrum, not the rotatories. And so the sacrum, the multifidi are covering those holes that have nerves coming out of them. So might be important to know. Anyway, they've labeled some things here like lateral sacral crest and medial sacral crest. They're talking about the little ridges on the sacrum. I don't want you to memorize that stuff. I hope you know what lateral and medial means. That's super important. But like, to me, that's kind of just saying like the left and right side of the sacrum. I mean, they're labeling some stuff that's not that important in that sense. But all those bumps make excellent attachments for muscles and fascia. And if you think your sacrum doesn't have a lot of fascia attached to it, try to pull it off your own sacrum. There's just a lot. It's really hard. Stuff gets stuck. I'm doing it to myself right now, trying to get the stuff on my sacrum. Anyway, super important fascial attachment place. And we are going to find that this sacrum is kind of where the gluteus maximus comes up, the thoracolumbar aponeuroses come down, and therefore everything kind of gets tied together right back in this nodule. Super duper important. We can see the coccyx back here, which is your tailbone. Probably doesn't matter to us, but just to let you know, we name all joints by the 2 things that come together. So this intersection out here is Bell Road and 29th Avenue. That's how we name the intersection. We name it by the 2 roads that come together. So your coccyx and your sacrum, the joint between the 2 would be your sacrococcygeal joint. We don't care too much because we're not messing with the sacrococcygeal joint that much. We're not down that far. But Ms. Sarno, that's probably where they broke their tailbone, right at the sacrococcygeal joint, and it probably snapped over like that. We can see in this picture the ischial tuberosity, which is a whole bunch of bumps on your ischium, which is where all the hamstrings attach. If we look at the back of the femurs, here we can see all sorts of very, very interesting things that will matter. For example, if we start at the top of the femur, on the lateral side, we see the greater trochanter. It should look like a very large bump. It is, because things like your glutes and all sorts of stuff hook into it. It's extremely important to hip function, and we will study that. You should be able to find the lesser trochanter if you go a little bit inferior and medial from the greater trochanter. If you go from the greater trochanter a little bit inferior and medial, you should see something called the lesser trochanter. That is a bump inside your thigh that you will never get to. Look how much meat is on this thigh between that and the lesser trochanter. But your iliacus and your psoas major or your iliopsoas attach there, and they're super important. This picture with the legs around it should tell you a lot as a massage therapist. I've talked to some of you about this. I haven't talked to somebody about this today in a way. I don't know if they realized it. But look at what your femurs do. They do not go straight up and down. They head out. Look how much inner thigh is on the inside. Look how much meat is on the outside. Look how close the greater trochanter is to the edge of the skin, as opposed to down further. This is why I don't rub somebody proximally up their IT band, because what happens is as I go up, I get closer and closer with less and less skin to the greater trochanter, and I end up running right across it. I'd like to go down, so I'm moving away from it, and I don't keep scraping their fascia across their greater trochanter, because I know that the legs actually do go out like this, right? The other thing that you can't see from this picture is they actually, when somebody's laying on the table, they actually kind of rise up from the knee, up to the hips. That can affect your massage. So Miss Vincent, actually today, when you were elbowing the back, not elbowing, you were using the forearm appropriately on the leg, but that's why I was saying you let your elbow dip in a little bit, because what happens is you'll hit that greater trochanter. You'll hit the, not even really the greater trochanter, but just the femur as you go up there. Anyway, these kind of angles and stuff like that are really important. And not intellectually important, but like in class to kind of be feeling for these things and be like, oh yeah, that's right, the bone really is here. Because we tend to think of legs, and we assume there's a bone right down the center of that leg, and it's actually not the truth. All right? Okay, so you got the greater trochanter, you got the lesser trochanter. Between the two trochanters, you've got a crest, and they call it the between the trochanters crest, or the intertrochanteric crest. And the quadratus femoris attaches to that. One of your deep 6 lateral hip rotators. We will also, I'm just kind of giving you highlights of coming attractions because we're going to do muscles. Yes, Miss Sarno, please.
Can I have a question?
Yes, you don't even have to ask. You just have a question. Go ahead.
Okay. In Thailand, I know someone, they back the car and hit the person, and they broke the tailbone.
Oh, they broke the tailbone, the coccyx.
And they cannot walk it, or
they can't walk?
They cannot walk for 8 months and have something to do with the tailbone or not.
It could. So it's not so much your little coccyx would ruin everything, but if you think about how much stuff ties, have you guys ever really like bruised your bottom, like you've fallen on it? And it feels like, yeah, it feels like you can't walk because of all the fascia that ties in there. So I wonder if they broke a little bit of their sacrum or something, maybe.
Yeah, I think
and that would cause problems.
I don't know, because I say, they say they broke their tailbone, and after that, I think more than that, because the car backed up there and they fall behind on the mat.
Because usually when you just break your coccyx, it feels uncomfortable, but you can walk. It's not pleasant, but you can do it. I think they broke more. I think they broke their sacrum or their sacroiliac joint. You know, something had to heal that was pretty big. I think more.
Because I don't understand. I just hear the people talking. I think I need to ask and to make sure this the tailbone broken and they still can walk or not.
I think it's more. I agree with you. I think it's more.
Thank you.
Everybody, by the way, remember that, just to warn you, clients will misinform you without meaning to. I don't mean they're lying to you. But we all just, doctors and everybody just throws out stuff. And people be like, oh yeah, I broke my whatever. I did this thing. Or I can't, this is the one I hear all the time. People come in and I go, oh, is this, like, they're like, I've got a little injury. I tore my bicep. So, and when I hear like tore my bicep, I'm thinking like you tore your bicep, right? They don't mean that. They mean like a hairline fracture. They went to the doctor and the doctor's like, oh yeah, you tore a little bicep. But they don't mean they tore it right off their arm, which you can do. So I hear that one all the time where people come in and they go, oh yeah, I tore this tendon. And I'm like, you tore your tendon? I mean, to me, that's, if you tear your tendon off your bone, you've got to get surgery to get it back on. It's serious, serious stuff. They mean they got a micro tear in it. They tore a tiny piece of it. They're still walking around fine, and I hear it all the time. I mean, I hear that all the time. Oh, I tore that tendon. Yeah, you did, but not like that. So just be careful what people tell you. And they'll even admit to you. They'll be like, I don't actually really know. I think that's what the doctor told me. So anyway, yeah, good stuff. Okay, so we got a greater trochanter, we got a lesser trochanter, we got an intertrochanteric crest, we've got a pec pectineal line almost makes me wonder if the pectineus inserts in that from the adductor muscles. Might. And we've got the medial lip of the linea aspera and the lateral lip of the linea aspera. Believe it or not, your quads are so massive that they wrap around from the front of your leg and hook and back on the medial and lateral lips of the linea aspera. I'll try to explain that better when we get to those muscles. And then of course you have the condyles of the femur. And the condyles of the femur are actually the thing that meet your tibia later and make your knee. Super important. Yeah. And that adductor tubercle, does anybody see that on the medial side of the right leg there? Adductor tubercle? Adductor magnus. It hooks in other places, but it's one of the places it hooks into. And most of the width of that leg, when you're looking at between, look at how big the adductors have to be to fill in all that leg. That's adductor there you're looking at pretty much. All right, cool. So that's just preview of coming attractions, just to get you excited. This is us again laying on the floor looking up, poor skeleton skirt or whatever we're doing, some inappropriate thing, but the point is we're looking up from the bottom, and that is the pubic symphysis there. Yeah? They're just trying to give you different views because it's very hard to show a three-dimensional body in a two-dimensional book. And later you will care, you don't need to really know it too much yet, but ramus means arm. And so where you see this inferior ramus of the pubis, what they mean is the arm. The pubis is kind of made of two pieces. So you got a superior ramus of the pubis and an inferior ramus of the pubis. They're just trying to discuss this bone, and they've got to name it. So it's got arms. Ramus means arms. And they don't mean arms like, but arms coming off, appendages coming off this thing. And that's about that. Here is a side view. I will call attention to you about stuff like the posterior gluteal line and the anterior gluteal line. Later we will find that like the gluteus maximus, medius, and minimus insert in those areas. That's how they got their name. Those lines are important for that reason. If you look at this picture and you find the anterior, inferior iliac spine, you'll see why it's extremely hard to find on a person. You can find the anterior superior iliac spine. It's very close to the surface. It's up high, but you're going in to get to the anterior inferior iliac spine, and we don't need to get to it usually, but that's where it is. Obturator foramens there. I think that's pretty good. Yes, I know. I'm glad you're shaking your head because that's how I feel about it. What they have done here, just so you know, if I took this model here and took this hip bone, just this hip bone off the sacrum, right, and let you look at it from the inside here, that's what they're looking at. They're looking at the inside of the pubic symphysis, the inside of where this thing connects to the sacrum and all that kind of stuff. And they're just showing you can name all of these parts. And lucky you guys will get to do that on your test. Yeah. I would not deny you that pleasure. I care way too much. Way, way too much. I was trying to think if there's anything here that I need to tell you about. Not really. And there's more. You have all weekend though. And this is from a lateral view, right? We're seeing where the femur hooks in. That's why we can see that there. And that's it. Questions? Comments? Concerns? I don't see a lot.
I want to do that.
I love that. Of course you don't want to do that. I don't blame you at all. Anyway, I don't know what to tell you about that. You guys have an assignment and a test on this chapter. Yep. Assignment, you have two things, 243s that you have to do. They're due by Monday. Yeah, due by Monday. Miss McDowell, I'm a very big believer in fairness and stuff, but I'm also a very big believer in working with people. And you are getting married this weekend, so you still have to do this, but I would be willing to discuss later times that it could be due for such an for a life-changing alternate event. I don't think you're going to need it, which is why I was saying it like that, but I just meant it's open to that. But anyway, it's just these two things. I say it like it's easy. It's not. The test has got like 86 questions, and there are a lot of labeling this stuff that you just looked at and don't want to do. Yeah. Happy wedding. And the other one is really short. Anyway, that's that. So I've released it, though. We should work on this. We've got 41 minutes to work on this right now. I'm here.